Hello and welcome to Life's Booming Series 5 of this most excellent and award-winning podcast. I'm James Valentine, and in this series we're going to ask the question, is this normal? I mean, as we age, stuff happens to us. Our bodies change, things fall off, we get crook, stuff doesn't work as well as it used to. There's nothing we can do about it. We're getting older, we're aging. But which bits are normal? Which bits do we have no control over? Which bits can we do something about? That's the kind of questions that we're going to be asking in this series, Is This Normal?, of Life's Booming. Now, of course, if you enjoy this series, leave us a review, tell all your families and friends about it. And we want to hear from you as well. You can contribute to this. If you've got questions about things in particular that you want to know, perhaps there's some particular wear and tear happening to you, let us know. We'd love to see if we can answer that question in the series. We're going to look at things like menopause, gut health, mental health, lots of other burning questions. So think about those areas, and if there's something in there that's specific to you that you'd like us to cover, let us know. From creaky joints to hip and knee replacements, let's find out the things that are really going to affect our muscles and our bones, our musculoskeletal system. Someone who knows muscles a lot better than me is Melbourne-based director of Platinum Physio, Rod Grof. Rod helps his older patients to live more active lives with less pain, and he can share what commonly happens to our bodies as we age and also what we can do about it. But before we bring on Rod, let me introduce someone who's very familiar to you. You're going to know him. He's a great guy and a marvellous actor. You got to know and love him in Blue Healers. He's currently in the Ensemble Theatre's The Great Divide. The gold Logie-winning actor, John Wood. Hello, John Wood.
Hello, James. How are you?
Good. You're a bit crook.
Oh, well, not that crook. I've had rheumatoid arthritis for about the last 15 years, and it sort of slows you down.
What'd you first notice?
Pains in the ankles, really, quite severe pains in the ankles and difficulty getting around. And then I started to notice it in the hands, like it was, the knuckles were really swelling up and the hand was very difficult to move. But I also discovered I had gout. Certainly in this hand. This hand I had an MRI done on, and it was full of uric acid.
Yeah, right. Right. And were they what did they say at the time? Was that compounding? Were they separate things or compounding one another?
Well, they're separate, and you take different medication for them both. I mean, you take allopurinol for the gout and methotrexate for the arthritis, and I've started taking curcumin recently, which seems to settle things down a bit, and muscinophone. And this week I've had, I don't know why it happened, but I seem to have something like bursitis. There's no lump or swelling or anything, but the elbow has been giving me jip.
It just happened. It's like, what do you do? It just happens, doesn't it?
Well,
everything starts to go a bit.
It's
How long a period, like from say the ankle pain to the joints? Are we talking months, years?
Not very long. It was. It just seems that I've got rheumatoid everywhere, like it's, apart from slowing me down a bit, it hasn't really affected my work, except for one occasion I auditioned for the Harry Potter musical, and they had us marching up and down and across and sideways and doing all sorts of stuff, and that was all fine. Then this associate director from England said, "Now I want you all to fall down." And I said, "Look, I can't even get on the ground to play choo-choo trains with my grandkids." So I said, it's a big mistake getting me to fall down. He said, "Never mind, fall down anyway." So I fell down, and then I had to be helped up by Julie Forsyth and a couple of other women.
And so it doesn't impede you that much, but it's painful. It's always there.
It's very painful, yeah, but at the moment, it's not too bad. I guess you get used to it as time goes on, and I've been lucky. Now, the methotrexate has stopped any, the stuff that sends
swelling. Yeah, it doesn't seem to be there.
No, and I remember seeing old ladies when I was a kid, whose fingers were really gnarled and bent and
sort of formed into a claw almost.
Yeah,
sort of
yeah, shocking.
Yeah. And so, apart from the drugs, what else have you tried? Exercise, diet.
I'm trying. I'm staying at Kirribilli at the moment, of course, and it's a bloody long walk up to the shops at Milson's Point. Just about, like, I'm getting fitter.
Well, let's bring in Rod. He's Director of Platinum Physio, and he helps patients like you, with, I suppose, the non-chemical approach and trying to get that bloody long walk to maybe go a bit bloody further. Rod, thanks for joining us. What are you hearing and what John's telling us?
I'm hearing a very common story. We have plenty of patients who come into our clinic with rheumatoid arthritis, and you said, John, 15 years ago was your onset of it. So often we hear that rheumatoid arthritis' onset is between the ages of 30 to 50 years of age, and you're currently taking methotrexate. Just for our listeners, that's actually an immunosuppressant. So it's going to slow down the immune response and in turn hopefully reduce the inflammatory response as well. And starting in the ankles, that's fairly common, but more so starting in the hands and the feet is probably the first point, and then it progresses to the knees, the ankles, and as you mentioned now, the elbows.
You think the elbow's rheumatoid?
There's a very good chance that it would be, yes.
Oh, great.
But again, without a proper assessment, we can't categorically tell you that. But just interestingly that you mentioned that, when James asked you about the exercise side of things, there's some really great non-pharmacological interventions, John, that you could really get involved in. And one of them, which I could speak really highly about, would be something called hydrotherapy, which is exercising in warm water at approximately 34 degrees Celsius and just being able to really get a good workout and have a really targeted workout, which will address your muscles as well as your tendons and your ligaments that are ultimately affected by rheumatoid arthritis to help improve things like your flexibility. And it'd be interesting to know, have you noticed that you've had changes in your flexibility or mobility over the years?
I've never been all that flexible. I was told when I was in my early teens, I had back trouble, and the doctor discovered that I had 2 L5 vertebrae. And I, like most men, I used to use my spine like a crane and just,
And so is that, so during the course of the rheumatoid arthritis, say the last 15 years, has anyone suggested exercise or anything apart from drugs?
Well, I was doing my own exercise. I was walking in the RACV club pool at a place called Healesville in Victoria, and it's really great exercise because it's 1.2 metres deep. It's a heated pool. It's not heated as warm as Rod suggested, but and it's great. I mean, walking through water. And I used to do
But that was sort of self-prescribed, was it? You just thought, this is good.
I just thought this is, the water takes a bit of weight off the joints. And
But no one has said at any point, when you go back to get it checked, or, no doctor or anybody else has said, just go and have a chat to the physio. No. You hear that a lot? A lot of people don't know what you can offer, Rod.
Yes, that is the case. And our Physio Association are really pushing forward the campaign just to give the general public to get a good understanding of the breadth of what we do. And it's not just about musculoskeletal. We also treat patients neurologically. We also treat patients, cardiothoracic wise as well. So there's a lot that patients don't know that physios can do, except for massaging, Chris Judd on the sidelines at an AFL game.
Yeah, or or actors who need a little bit of help.
Yeah, absolutely.
Can't get up off the Harry Potter stage at any point. So, would you consider it now, John? We can go in a little bit more about what Rod actually offers.
I certainly.
Are you open to stuff?
Yeah, of course I am. Yeah. I'd be very happy to talk to Rod. I believe you're in Melbourne, which is
yes,
my
I'm based in Melbourne.
I'm just up here working at the moment.
Yeah. So rheumatoid arthritis, how common is that?
Rheumatoid arthritis is fairly common. It's a condition which is an autoimmune disease, which basically means that your body essentially is attacking itself. It's malfunctioning, and it's different to other forms of arthritis, or the more popular or more well-known type being osteoarthritis, which is more of your wear and tear type of arthritis. With rheumatoid arthritis, that is when the body is actually attacking the lining of the joints, and that causes the redness, causes the swelling, and really a significant amount of pain and loss of function.
That would suggest to me it's kind of curable. Can we take something to fix it?
So sadly, it actually isn't curable. However, it can be managed. So that's where I come into the picture. The non-pharmacological side of things is, exercise, good sleep, nutrition, stressing less, having a really good lifestyle, and being active, yoga, meditation, mindfulness. All of these things are really important to help manage that condition from a non-pharmacological perspective. And when you go and see the quacks, see the docs, they're the ones that are going to feed you all the different pills. And I always say this: if there was a pill for exercise, every single doctor would be prescribing it.
Yeah, but it's, in some ways, it is the hardest one to do. If you haven't had a discipline of it in your life, it can be very hard to start.
Absolutely. No, we have plenty of patients that come through our door that are across the lifespan, and some of them have never walked into a gym in their life. And the gym is a real central feature of our physiotherapy clinics.
So what's going on in this gym? What are you doing?
So in the gym, we're actually completing some physio-supervised exercise. So we're actually taking the patient through a physio-tailored exercise regime, which addresses whatever their deficits are.
We said, if you haven't had exercise or you as part of your life, or you're not used to gyms, maybe that can be a bit forbidding. I mean, the other difficulty that can come with aging is that you're not as limber as you once were, or you've got another injury or a knee problem or something that may interfere with you doing the exercise.
Absolutely. So often as well, having other niggles is a massive deterrent. And again, we've had patients that come in all the time and say, look, I used to be a runner, and, I unfortunately was climbing a ladder one day and doing some housework, and I fell off the ladder and I landed on my knee, and I had to go to surgery and had to go to hospital and have surgery. And unfortunately, that moment in time has really prevented them from going on to do any form of exercise or rehabilitation, whereas that's the time that should really be the impetus and really give you that motivation to start getting better, because there's just so much that can be done.
It's common at this point to start to have, I've got a bit of a creaky knee and a bit of a dicky hip, and my elbow's a bit weird when, the sun's at 45 degrees and I just played tennis 3 days ago. It can all feel a little bit ill-defined, or you've had a bit of a go at a couple of things and nothing much happened or changed. That's what it can feel like at this age. Oh, hang on, I'm describing myself. And you're not sure whether to seek treatment for every creaky bit that's going on.
Yeah, so what you're describing is, noisy knees is a great example. The reality is, if it's not painful and not affecting your quality of life, just play on. Don't worry about it. We become so obsessed, and we hear so much about, bone on bone and my joints are creaking and cracking. Well, there's plenty of evidence to suggest that people who are bone on bone actually don't have any pain. And there are those that have pristine looking joints, can't get off a couch. So based on that, there's really good evidence, really important lifestyle choices that you can still make. And based on that, we would encourage you, even if you're hearing all these interesting sounds in different parts of your body, work through it. And if it's progressively getting worse, that's when you do seek treatment.
Do you start with the physiotherapist? Do I go to a GP? Do I go to some other doctor and then get referred to you?
It's a great question. Now, I believe when it comes to musculoskeletal related conditions, go straight to your physiotherapist. Here in Australia, you don't need a referral. So it's very, very accessible. Often we'll have patients that will go to a GP, and the GP says you need to go see a physiotherapist straight away. Also, there are some GPs, though, they might go, oh, okay, you got a bit of a creaky shoulder. Maybe we need to go and do an X-ray or do some imaging. So I've seen people walk through my door with a wheelbarrow worth of scans. I'm talking about scans including X-rays, MRIs, CT scans, ultrasounds over the last 20 to 25 years in relation to whatever joint it is that's bothering them. Now, these people have done the ring around. They've gone doctor shopping and seeking answers. And they come through our door because this one doctor in the last 20 years who they've seeked has said, why don't you go and see a physiotherapist? So they come into our door, and the first thing we ask them is, have you ever seen a physio? They say no. Have you ever done any form of exercise? They say no. Okay, well, great. Here's a starting point. And I try to soften it. I don't say, we've got a gym out here, let's go and do some gym work. Because again, the idea of going into a gym can be quite terrifying for people because they think of macho men with their tops off and flexing their muscles in the mirror. So just to sweeten it up a bit, it's more of a rehabilitation centre, and that just kind of takes the edge off it a bit. And that way we at least get that buy-in and introduce them into that gym setting.
Let's talk a little bit more about the difference between rheumatoid and osteoarthritis, because I think we spent a fair bit on rheumatoid. Osteo comes on when in your life? What's it caused by? What is it?
Absolutely. So osteoarthritis occurs, pretty much over the age of 40 years of age. There's different degrees of it, different stages of it. It is a progressive condition, and it's part of unfortunately, it's part of the aging process. Like we get grey hair, like we get wrinkles, that's all age-related changes. These things are common with arthritis, or osteoarthritis, where the cartilage that lines the joint changes. And that can be as a result of different mechanical stresses that you put through your joints, and more commonly wear and tear and genetics. Unfortunately, we can't really fight genetics. So one of the biggest, risk factors that you can't change for arthritis is your age, your sex, and also your genes. And when I say sex, it's more common in females than it is in males. Now, arthritis, unlike rheumatoid arthritis, affects more of your major weight-bearing joints, i.e. predominantly your hips and your knees, okay? And again, you might get sensations of what you described before, which was the noisy sounds. We call that crepitus. That's the medical term for it specifically. You might get some bony enlargement as well around the particular joint that you're working with. And unfortunately, there are the factors as well. The other risk factors that are actually modifiable are things like improving your muscle strength, improving your level of physical activity, and also, again, just ensuring that you're living a healthy lifestyle.
Yeah. So when this first occurs, can you slow it down? Can you get rid of it?
So again, it's not that you can get rid of osteoarthritis. However, you can slow it down, and you can, by doing all of those implementing most of those modifiable factors, as I said, particularly exercise, weight loss is a really big one as well. And just by the way, this is quite an interesting fact, which I'm sure your audience will find very interesting. For every 10% of body weight that we lose, there is a 50% reduction in the amount of loads going through our knee joints.
Yeah, well, that's amazing. So I lose 10 kilos, it's like 50 kilos less through my knee? Is that what that means?
So it's 50% less load going through the knee.
Load.
So as a great example, I had a gentleman who I saw last week, and I've been seeing him for the last few months. He came in initially with significant knee pain, referred by an orthopedic surgeon for physio prior to having a knee joint replacement. And we had our discussion about what are the first line of interventions and treatments that we can do to assist you and hopefully potentially slow down the process or delay the operation. But again, he was on a wait list, so in his mind it was happening. I go to him, do me a favour, let's try and lose 10 kilograms, go consult with a dietitian, and let's get you onto a exercise program, which consisted of twice weekly exercise under physio supervision as well. And this patient now came in last week. He weighs 90 kilograms. He couldn't walk. He couldn't get off his chair without pain. He couldn't walk around the block. He couldn't go to his letterbox. And now this guy is walking and getting up and picking up his grandchildren off the floor completely unrestricted. It's quite astonishing, and he's a really great example of what, physical activity and looking after yourself and being motivated can do. So he's actually now completely called off that joint replacement.
Now, for many, it will end up in surgery. Is there an ideal age? Is there a right age for this sort of thing? What are the conditions in which you would go, well, okay, yes, you're going to have to replace the hip? You're saying it's hips and knees that get most affected by osteoarthritis, so that's the things we tend to replace, isn't it?
Absolutely. So the most common areas or the most common joints that get replaced are our hips and our knees. So at what point would you get the operation again, everybody's different. Typically, these operations have around a 15 to 20-year lifespan as well before you have to go in again and get it revised. And that can be quite a big procedure, and one that, surgeons are happy to do, but if you can delay it, the better. So ideally, 65 to 75-year-olds are the most common age bracket that will end up having a joint replacement. Any earlier would suggest that your arthritis has progressed quite significantly, and it needs to really affect your quality of life. Because at the end of the day, it's not a magical bullet. It's the last resort. In terms of the triage of what needs to be done, education, exercise, weight loss is number one. The next phase is looking at things like injection therapy, taking pain relief, taking anti-inflammatory medication. And again, if that's still not giving you the quality of life that you're after, that's when you look at having joint replacements.
Rod, let's just think about other general wear and tear things that happen at this age. We've talked about hips and knees. We've talked about the two main arthritis things. What are the other main sort of physical wear and tear we're going to expect?
Sure. So our tendons, which connect our muscle to our bones, are different bodily structures that with time, they go through that wear and tear process as well. And again, the solution to ensure that you don't have any issues like what we call the medical term for it previously was known as tendinitis. Now it's actually been changed to a tendinopathy, because we know there's not really inflammation per se in the tendon, but the issue is the actual genetic or the makeup of the tendon. As we get older, the collagen fibers become a bit more frayed and disorganized, and that is part of the aging process. So again, what's the solution for it?
Can I guess? Can I have a shot at this? Let me see. Might it be exercise? Might it be some resistance? Could diet be a factor here?
All of the above. Fantastic. So it's pretty
I've been
simple.
listening so far.
It's a very simple solution. And again, I can't emphasize, and you can hear my passion about this is why I do what I do. My motto is to keep people active and healthy to live the life they love. And by doing so, we're able to ensure that they can pick up their grandchildren, go for a walk with their friends singing Taylor Swift around the park, and really have a really great quality of life and enjoy the last 30, 40, 50 years, because there's no reason that we should let age get in the way.
Let's bring John back in. John, is there anything in particular that you've been listening to the kind of conversation we've been having, anything you want to ask, Rod?
How does one go about visiting you? I mean, I would be very happy to come and have a chat at some point.
So if you want to come directly to the clinic or directly to any physiotherapy clinic, I would ask a few questions, because some clinics don't necessarily offer management of rheumatoid arthritis. It might be slightly out of their scope.
And there's simple sort of exercises you'd start with. What would be, if he signs up to it, what would be some of the first things he might be doing?
So look, mainly the exercises that we'll focus on initially would be in relation to just improving your overall mobility and giving you a structured walking program as well, and just gradually increasing the distance, the time over a period, because we know going too hard too soon can actually have worse outcomes as well. Especially in over 65s, balance is a really big issue. We know that 1 in 3 people over the age of 65 fall.
Well, I have noticed that I'm more prone to falling over, not being able to get my underwear on, stuff like that.
All right, well, on to more pleasant things, really, John. You're in a show. You're acting.
I am working. Yes,
you am working, which is excellent. It's a new David Williamson play now.
It is.
From memory, David Williamson's. I think he's retired more times than Melba, hasn't he? Isn't he?
Well, not yet, but the last play I did of David's was his last play.
Right.
Yes, I did that in 2020, and. We were closed down in our last couple of weeks by COVID.
Oh, right.
And then I got on a plane and went home with a whole lot of people that Gladys had let off the...
the Ruby Princess.
The Ruby Princess.
So you probably brought it into Melbourne. You're probably patient zero for Melbourne.
Well, I could well be.
So to what now, 4 years later, three or 4 years later, he's back with another play. I mean, I don't want him to stop, but he keeps telling us he is. And so it's a new play called The Great Divide.
Yes, and it's an interesting piece. And it's getting better and better all the time. The best writing in it, for my money, is are the scenes between the younger women, who's a mid-30s mum and her 17-year-old daughter.
Right.
And the writing for those scenes is terrific, like the relationship's wonderful and the girls are terrific.
Tell me a little bit about that rehearsal process. It's interesting you say it's getting better. I suppose in most of our minds we think, David Williamson's there at the desk, he completes the script and then, there you go, fellas, just say what I just wrote. And I think this is another thing to realise with Australian plays, isn't it? That we often see them very fresh, whereas the thing from overseas, it might have been through a lot of rehearsal, a lot of different productions. So, this, you will have a chance to see something here that's absolutely brand new.
Yeah, we had a session yesterday afternoon at 4:00 where a group of people from the Ensemble audience that pay money to come and watch the director at work.
Yeah, nice.
And so we've already yesterday been in front of a small audience of about 20, and we had a quick Q&A afterwards, and and it certainly worked for them. But there was one lady there who wanted to ask me about a line that I'd done in crunch time.
Right.
And, I spent the whole play trying to get one of my family to give me the lethal injection.
Right.
And I had forgotten all about this, but I have a line which says, if you want anything done, you've got to do it yourself. And this woman had picked up on that, and she had a copy of the text, and it wasn't in the text.
Oh.
And I have no recollection of myself and Mark Kilmurray discussing putting that line in, but
must have popped in there at some point. How do you find it when it's 6 shows a week, 8 shows a week? We've been talking about your arthritis and these sort of things. That's a big physical demand. You'll be in the season soon enough, and you're a veteran of doing this. Physically, how do you find it now?
I don't think I have any major problems with it. The arthritis is mainly under control, unless this elbow thing that Rod told us is probably arthritis.
Yeah, sorry about that.
But I don't, I've been managing to stay working for most of the time. When Blue Healers came to an end, I was massively disappointed, because it had been 12 years of just having to drive into the city and do the show and be on a pretty good wage. And
that's enough of that, young fella.
And Doyle, my office, and you'd be, to suddenly lose that income was shocking.
Yeah.
But I've been working in the theatre pretty much all my career. When I was doing Blue Healers, I was also doing Williamson's play The Club all over the country.
Yeah. Great play.
And it's the funniest play ever written in Australia, in my view. It is just hysterically funny.
Yeah, but that's good if you don't find the season taxing.
I can't imagine what I would do if I stopped acting.
Well, I think you're a great advertisement for you love it, so why stop doing it?
I can't imagine what I would do. It'd be nice if there was more financial reward involved in the industry, but we were left high and dry by ScoMo and his government during COVID. Shocking. His attitude to the arts and music, I think, was appalling.
John, you said that you started in your ankles perhaps 15 years ago. If you think back to sort of, in your 30s to your 50s, perhaps when you're doing Blue Healers, no signs of anything that perhaps should have dealt with?
I was going to a chiropractor. I went to chiropractors for years. And I have since had a partial discectomy, where they just cut a little slit down your spine and cut off the excess disc. And that was fine, and I'm very careful with the way I use my back now. I've stopped using it as a crane, and that was the first year of Blue Healers, so that was 1994, and the worst thing about that was I was supposed to go to the UK with Lisa to do publicity, and I went into hospital to have the operation. And I kept looking out the window thinking, not very far away from here, the crew and the cast are having a rap party and I'm missing it.
Well, it's fabulous to get some time with you, and I know we're going to see you on stages and screen, for many years to come.
I hope so.
Despite everything spreading to your elbows and everywhere else. But Rod, thanks so much for everything you've offered. Absolutely fantastic.
My pleasure. It's been fun.
We'll see you again.
Thank you very much.
John, thanks so much for being on the program. Great to catch up with you. And as we're saying, we've been talking about is In the Great Divide by David Williamson. It's on at the Ensemble Theatre in Sydney until the 27th of April. I'd like to say, break a leg, but I don't think that's probably good advice at this point.
Oh, it's a pleasure to be here. Thanks, James. Lovely to see you.
Thanks so much to Rod Grof as well from Platinum Physio in Melbourne. You've been listening to Season 5 of Life's Booming. Is This Normal? Brought to you by Australian Seniors.